6:44 right now. Potentially deadly diseases like cancer are challenging to diagnose during this pandemic, especially with the stay-at-home orders in place. And Dr. Jason McKellop is a radiologist, the medical director as well of BreastLink in Tarzana. Doctor, good morning. Thank you for joining us.
Good morning. Thank you for having me.
All right, so doctor, many people are nervous about going into any kind of hospital or medical office, anxious as well about these following up on appointments and x-rays and mammograms. Some people might not even know that these appointments are still happening. So how do you reassure people to not put these off right now, especially for folks who just found out that they have cancer?
Absolutely. In the past several weeks, COVID-19 has stolen the headlines and attention, rightfully so. But at the same time, I fear that we may lose track of ongoing medical conditions like cancer, and my subspecialty, breast cancer specifically, that may go unnoticed or unchecked during this crisis. So what we try to do at BreastLink is to reassure patients and make sure that they know that they're in a safe environment, an environment that is free of disease transmission as it relates to COVID-19, and one where they can safely and appropriately get timely health care that they need.
Doctor, how dangerous is it to delay some of these screenings?
Indeed. There are a lot of medical conditions outside of breast cancer, which is the focus of my subspecialty, that are time sensitive. Breast cancer, as we know, if diagnosed early, can lower morbidity and mortality related to the disease. In other words, if you diagnose disease when it's small, and we can see it on our imaging studies, a patient stands a better chance of surviving long term.
And we talked to this morning Jill, a survivor, and she said she would not have been able to detect her tumor during a self-exam, but a lot of the routine screenings are on hold right now because of coronavirus. So what should people really be doing right now? How do they get the guidance and the direction that they need in terms of what steps they should be following?
So we try to triage each patient on an individual or as personalized a basis as we possibly can, balancing risk factors, so family history, genetic predisposition, and so forth, in the urgency of them needing a particular exam. And we try to do this in concert or in coordination with the referring physician. So in that effort, we communicate either directly with the patient or with the referring clinicians to try to gauge the level or index of suspicion that we have prior to the patient stepping foot into our facility. But we, like I said at the outset, we make the environment as clean and as safe as possible. So one should feel safer at a BreastLink Tarzana site than they would otherwise at their local grocery store, for instance.
All right, Dr. Jason McKellop, thank you so much for joining us this morning. We appreciate your insight and for what you do for our community. We appreciate you. Thank you very much.
Thank you.
Daniela?